Okay, now I'd like to, before I utter a word, what I'd like to do is to ask you what you think of the peer discussion review. It's not I'm not asking for a lengthy answer, just whether you think positive, negative, or not sure. And the poll is anonymous, so I don't know who's voting for what, but I can tell you that people are voting in different ways. So in a moment, I'll share that with you. So we've got, okay, lovely. So I don't know whether you can see that. You're all mute. Every time we have a meeting, I always say to the speaker in advance, don't say, can you hear me? Because everybody's mute, and so they can't respond. But presumably, if you can't see that, unmute and let me know. But basically, most people are not sure. Some people are positive. I would suspect the people that are positive are probably the ones that have done the peer discussion review, because it's nowhere near as bad as you think it is. In fact, you might even enjoy it. So as I said, I'll be doing the administration and the speaking. So I will have to do some admin at the same time. The other thing is, I'd like to go straight through, because what I don't want to happen is for us to get involved in a forum, questions and people commenting, because otherwise I don't want to overrun, and then we'll have a completing your peer discussion review part 2. I think we can deal with it quite quickly, I'm absolutely sure. You may want a pen and paper. There's no presentation to download. So this came about as a result of various members of the committee finding out that people were so depressed or dismayed or unhappy about the peer discussion review, they didn't know where to start. But it's actually a lot simpler than you think, as I'm going to show you. I remember about 20 years ago, probably about 20 years ago, I was in Osteopathy House. These were in the days of Madeline Craggs, and there was there'd been the Harold Shipman affair, you know, the doctor who murdered a lot of his patients. And subsequent to that, the GOSC introduced a CPD scheme, and I thought it was ridiculous, because I thought, well, you know, how many osteopaths murder their patients? But since then, we've become to accept the CPD, and I suspect that after you've done the peer discussion review, you will come to expect to accept it. What are the objectives of the PDR? Well, a lot of, as it has happened 20 years ago, what happened was a lot of osteopaths were working on their own, and they were just left to their own devices. So the GOSC has tried to get everybody reflecting on their practice and meeting other osteopaths, discussing the way that they conducted things. I remember years ago that it was common for people to give people what were described as general osteopathic treatments, and that more or less whatever anybody came in with, they'd get a couple of neck manipulations, 2 dogs, and a lumbar roll either side. So they wanted to get away with that. Another objective is for us to step back to be objective about our practices and to reflect on our own practices. Now, in preparing for this, I didn't use the templates, because GIOSC provide templates for you to so you can obviously look at the template and see what other a theoretical osteopath has done. And I looked at the templates and I thought that they were, hold on, there's 13 people in the waiting rooms. I'm awfully sorry, I didn't notice that. Where was I? Yeah, I didn't use their templates. I read the GEOS templates. I thought they were a bit confusing. I'm just letting somebody in. I thought they were a bit confusing. They talk about another osteopath talking about meeting thing A and B and C, and so I have not used those. The other thing is, yeah, I didn't use the templates, and the other thing, when you look at the peer discussion review template, the initial pages, I think, are daunting. They have a time frame whereby you you prepare for your peer discussion review, and then 30 days later you start writing it up, and then a bit later you submit it to your peer. So I've ignored that. So my objective today, sorry, I've got to let some more people in. My objective today is to make it as simple as possible. So you have got, one of the problems with the peer, I think, with this review process is that you've got too many options. You know, when you're hungry and you go into the supermarket and you can eat English, Mexican, Indian, or whatever, and you don't know what to eat because there's just too much choice. And I think the problem is that there's so much choice that one can be rather bewildered. And for that reason, so I'm just going to let some more people in, and for that reason, you don't know what to do. So the options are that you can work with another osteopath, a group of osteopaths, a school, or an interest group. You can work with other healthcare professionals. You can divide up and work with your PDR with different groups of people for different groups of the PDR. You can do it on Zoom, as we're doing now. You can do it on the telephone. You can meet up, and you can also write it on a piece. You can print out the form, or you can. Sorry, I'm still letting people in. Or you can do it electronically. So what I propose is that you print out the form. Now, obviously, the way you do it is entirely up to you. And if you want to subsequently submit it electronically or whatever, that's entirely up to you. But I propose that you print out the form, you write on it with a pen, you contact a local osteopath, and you meet up in person. We've not met up with each other for a very long time, possibly 2 years for some people. So it's a welcome excuse to meet up with another osteopath. So in addition to discussing your review, you'll discuss other things that osteopaths chat about. Now, as far as the template is concerned, incidentally, I spoke to Stephen Bettles this morning, who was involved in developing this scheme along with Fiona Brown, and I said, why is it called a template? Because I think the word template is actually a bit off-putting. I said, can I just call it a form? And he said, yeah, fine, call it a form. I said, a form to fill in, okay? So it's a form you're filling in. Now, you're also, the osteopathic guidelines, it's in the review itself, in the preliminary pages, it says the template is designed to be completed at the review, or some will prefer to complete a draft review and submit in advance to peer. But it also says the osteopath may find it helpful to complete the relevant sections of the PDI in advance themselves. So that's what we're going to do. If you decide to complete your review with a colleague, then not only will it probably take about 2.5 hours, but they're going to also be, you're going to say, oh, shall I put this down or shall I put that down? So once you've completed that, you'll only have it from the point of view of the peer. So the other thing about our talk today is I'm assuming that you're going to do that. You're going to latch up with another osteopath and you're going to probably do each other. And I think that it'll probably take, each will probably take an hour to an hour and a half. So that's a total maximum time of 3 hours. One thing I must stress, and that is to please answer the questions of the review, because they're quite specific. Sorry, I've got to let somebody in. They're quite specific about what they want. And I know you may have done this piece of CPD that you're really rather proud of, but don't put that down. Look at the question that's being asked. We're going to go over the questions. There aren't that many actually, but we're going to go over the questions, and so you answer them, because at the end of the review, you're doing very much the review. They've stressed this. You're doing the review for your own benefit, not for audit. At the end of the review, and you're left with this bit of paper, and you think, what do I do with it? Well, the answer is you don't do anything with it. You just hold on to it, and they'll carry out an audit of just see how people are going, how people are responding, and also obviously the fact that people are doing it. So you'll just hold on to it. So make sure you answer the questions. So let's sorry. Sorry, I honestly rehearsed it. Well, I need to let some more people in. I did rehearse this, and I know that our speakers. There we are. Okay. So, we put the kettle on, and we've and you each have. Oh, sorry, there's some more people wanting to come in. So we've got the peer discussion review. The first page is very straightforward. It's just filling in who you've done it with. Excuse me, just a moment. And I'm letting people in at the same time. This is the problem when you do everything yourself. Okay, so no, it's not working. Bear with me just a moment. We're going to go through the peer discussion review when I work out how to share. There we go. Okay, sorry about that. Okay, so the first 2 pages of the form are very straightforward. It's just, I mean, really is fitting in the form, who you're doing it with, whether any money is changing hands, and so on. And then the next page is osteopathic guidance. In this box, please describe. So now, in order for you to be able to see what the questions are, I've had to reduce the box where you're going to put your replies. So the blue box you can see at the bottom of the screen is actually much bigger on the actual form. So that's pretty straightforward. I won't read it out because you can read it out yourself. Oh, now my other computer's not working. Yeah, there you go. Okay, so onto the standards. Now the first standard is where you can read what it is. If you go to the guidance notes, it tells you to, sorry, just letting somebody in. If you go to the guidance notes, it tells you to refer to the osteopathic practice standards, the booklet, but there actually is a much, much easier way of doing it. And that is, if you, oh, excuse me, just can you, excuse me, just one moment, because this isn't working on my other computer. I'm sorry about this. Okay, so there's an easier way than going through the osteopathic practice standards. There is a page on the workbook, which is supplied by GEOS, and it's page 19C. And I've actually put it on the LOS website along with the peer discussion review. And it looks like that. And it explains beautifully the what the 4 standards are. And the bit that we want to home in on is that bit. So this is a detail from the workbook. So they want you to just do one thing from each of these. So you have to do one thing on communication and patient partnership. They're not asking you to do communication skills, values, consent, capacity. Those communication skills, values, consent, and capacity are examples of communication and patient partnership. So you don't have to do everything. You don't have to do all of them. You just have to give one example of communication and patient partnership. Now, looking at the last review, the last lecture that we had Helena Bridge talking about headaches. So I think almost any seminar that you do or any piece of CPD that you do will enhance your knowledge. So B has been ticked. She talked about how you talked with your patients about headaches. So I would say communication skills. She talked about extensively about how you evaluated a headache with flow diagrams. So that's evaluation and diagnosis. So on the basis of that one lecture that we did on the 30th of November, you've answered 3 of those questions. I mean, you've done something that pertains to those. Now, with D, which is professionalism, we actually have done some lectures with LOS, which we had Paul Grant talking about at the start of the outbreak, about how to handle COVID. And Joe Wiley was talking about mental health. So that's communication skills. Martin Pendry did a health and safety on the 16th of October. That was at Friend's house. The first one was actually online, and the second one was online. The third one was Friend's house, and the fourth one was online as well. So we've actually answered questions. Well, if you've got any questions, some people have put some things in the chat, but I tell you what, I'm going to ignore the chat for the time being because I think that I've got enough on my hands trying to cope with this with 2 computers. So at the end, we're going to have a forum. So anyone that's done the review can say anything they like about it, positive or negative. Any questions? If I can't answer any questions, I refer to somebody at GEOS and ask them. Okay, so I think you've answered those questions, because even if you just attended that one lecture, you should have covered those criteria, the stipulations. So I think we've done that. If you don't think we have, make a note, let me know at the end. Okay, so that's very straightforward. Now, in that blue box, once again, I shrunk it, but it's it's like a page. So you just need to give one example each of these. So, you know, if you're going to use that, or the previous one we did was breathing pattern dysfunction in long COVID with Kelly Mitchell. So that would tick various boxes. So I'm just looking at the loss webinars and meetings that we've had. Obviously, you've got a larger portfolio of things, so you can choose. So I hope you're reassured on that one, because I think it's quite easy. So you're just going to list that, and then for the peer, the peer is just literally going to tick a box. Have you done it? Yes or no? Now this is a collaborative effort, not a conspiratorial effort. So if the osteopath hasn't done it, I mean, I can't believe you haven't done it, but if you haven't done it, or you're the peer and the osteopath hasn't done it, you have to tick no, and then you could put in the box, because that box is only if the osteopath says no, you could put, well, Tony Longoretti has done nothing on communication or whatever, but he's promised to do that. So he said he will do that before the end of his CPD period. So, but I think that everyone's going to reply yes to that one, because you've done it, you know. So the next one is osteopathic standard 2. Now, you may not believe this, but after we've done osteopathic standard 2, there's really only one other question insofar as the CPD standard is concerned, effectively. So now, when I was thinking about talking to you about this, I thought of going into the NCOR, you know, PROMS thing and the practice audit. But then I thought, well, I think people are probably here because they think that the PDR process is terribly complicated, and I have promised to make it simple. So I'm only really going to concentrate greatly on the case-based discussion, and I'll just pass over the peer observation and assume. So if you've done any of the other ones, or the other two, I think you're probably not here. Peer observation, that's when you come along to my practice and you observe me treating patients and we have a discussion. And I thought long and hard about what they're looking for here. And they are looking for some sort of reflection on your practice. So with osteopathic standard 1, which is the one we've just done, you know, it's a list of things, isn't it? It's a list of seminars that you've done. But with this one, it's actually reflecting on your practice and doing an activity which is going to cause you to reflect on the way that you do things. So going back to one of my initial comments when I said that osteopaths working on their own and becoming set in their ways, and I have actually seen it, but I think it perhaps doesn't exist anymore. But this is to encourage us to reflect. So, but reflect, but actually to participate as well. You can't just, so if you come along to my practice and look at me practicing, and we discuss the weather and my holidays and all the rest of it, and you say, oh yes, that's very nice, Tony. You know, we've completed the peer discussion. We've completed the peer observation, I beg your pardon. We've completed the peer observation. No, we haven't, because if we have no discussion and there's nothing constructive as a result, then it doesn't count. If the person who comes to take a look at me, comes to my practice, has me looking at the patient and says to me, Tony, I noticed that lady, she took her clothes off and she was sitting there with in her underwear, and you were asking her about your condition. I'm not sure you want to do it that that way. Tony, when you were asking the patients questions, you were looking at your computer, and the patient looked a bit lost because you were spending so much time looking at your screen. Or Tony, you were asking leading questions, you know, how much better do you feel? So, and I'm unaware of that, and also I say, oh, well, do I? So that would be something constructive. But I suspect that the people that, probably a lot of people that are here now, are probably going to want to concentrate on the case-based discussion, because that's the easiest. There's nothing wrong with the fact that it's easier. The GIOS gives you loads of options of, you know, what you can do. And some people are probably really, you know, into the review process, and, you know, perhaps you will be too after you've done this one. Don't feel as though you're being inferior if you're doing a case-based discussion, providing you do the case-based discussion. Now, so it can't be you going on your own, going onto the GIOS website, getting a case-based discussion and reading about it on your own. It's got to be discussed, but not only that, you have also got to reflect on it. And I know you're probably, maybe some people's hackles are bridling their hackles. I'm not quite sure which it is. But you do have to use the case-based discussion constructively to, and the wording that they use, inform your practice, or to put it another way, affect you in some way. So assuming that one's practice isn't perfect, improve it in some way, and for you to think, well, you know, maybe I didn't realize that, you know, the patients came in, took their, you know, if it's me, for example, the person's made that observation, I didn't realize the person came in and, you know, took that, and I didn't think about that, you know, what it must be like for them. So if you're going to do a case-based discussion, it's got to be the same sort of process. Now, if you're thinking that you haven't done a case-based discussion, if you've been a member of LOS for any period of time, we did a case-based discussion at Friend's house. And this was, if I remember correctly, it was a patient called Grant, I think his name was. But anyway, the basic thing of that case-based discussion was that Grant Small, I think his name was, he introduced his wife to the osteopath, and the osteopath made various assumptions. And then to compound it, the wife went away, and then the husband said, how's my wife, you know, how did it go? I, Tony Longorati, have a slight problem in this, insofar as I don't want to give you the answer. I don't want to tell you what to write if you did that one, or if you, obviously if you did some other one, and I can't tell you what to write, but on the basis of this one, saying you did this one, you're going to have to, I will say that when David and me did it, if you were looking at your phone, and I know nobody was looking at their phone, but if you were looking at your phone and you weren't participating, then you didn't do it. You only did it if you, not necessarily if you even spoke, but certainly if you participated in it in some way. You know, if you just regarded it as an exercise in being present, then you haven't done it, and you're going to have to do something else. You're going to have to pull another case-based discussion from the GIOS website, and you're going to have to make something constructive of it. If you're going to do a case-based discussion, it doesn't have to be a case-based discussion from the, one of the ones that they give you. I don't know if any of you have ever done any CPD where you go to usually it's a hospital, and they have a live patient there, and they discuss that case. That would be valid if you participated and if you took something from it. So if, for example, they were discussing somebody who had rheumatoid arthritis, and they were discussing the treatments options, and it was something you could take away with regards how you conducted your practice. So it's not like standard one where you said, you've done so many hours of CPD, and that included, you give an example of learning a thing. So it can't be that. It's different from that. It's taking something away as far as you communicating with your patient. I'll just go back to the what they actually say, because actually what they say, it will not be met if the osteopath is unable to show how they have learned from objective feedback and how this has been applied to their practice. So whatever it is, you've got to take something away from it. You had to have participated in it. You have to have taken something away from it. So I hope I've not disheartened you, because you have done this one. Most of you will have done this one. And if not, then I suggest you get together with you, perhaps pull as a minimum, you pull a case-based discussion from the GIOSC website, and you could even do it on the phone with a colleague. You can discuss it and make of your will of it. So let's go and see what questions they ask about it. So that question is just asking you whether you've done it, and then on your reflections on it, what you've done, and you've recorded the aim of the objective activity. So you've thought about, if it's a case-based discussion, we'll sort of make it that. What was the object of the activity? So I can't discuss the one that we did, because I don't want to give you the answers, because I think you have to do some work. What you did, well, for the one that we did, we were all together, and we did, and everyone put their points of view on what the osteopath did and what perhaps they could have done better. The outcomes of that particular case, and include any impact on your practice. So if you're feeling a bit down in the dumps because you don't feel as though you can satisfactorily answer that question, there is a good way of looking at it, and that is if you had the discussion and you think about people that you've had in your practice, where you've had the same sorts of situation. For example, with the one that we did at friend's house, the osteopath made assumptions. And have you ever made assumptions? So has that impacted on your practice, the fact that you did that case-based discussion? The other thing is, another thing is, you perhaps can find more, but another aspect would be the fact that the husband in that particular instance rolled back into the office and said, oh, so how did it go with my wife? So we've all had that sort of situation. So you could think about that. You could incorporate those two elements into that particular case-based discussion. And if you're using a case-based discussion from the website, then have a similar sort of a reflection. So we want it to have some sort of impact on your practice. Osteopaths are working, as I've said, osteopaths working on their own, becoming set in their ways. So GIOSC are trying to get us to reflect on the way that we work. So the peer, for the peer, they have to fill in how they've used the feedback. So you're gonna make it easy for your peer, because you're going to answer the questions. Look how you've used this constructively. So that will make it easier for the peer to complete this section. And once again, I can't really fill the thing in, you know, for the peer. The peer will have to look at what you've done and reflect on how you've how you've recorded it, what it not necessarily what it was, what you did, you know, how you participated in it, how you reflected on it, whether it's made an impact on your practice. So that's what the peer's going to do. Now, just un momento. Right, yeah, so the next bit is just the peers completing this. So we want the peer to be able to say yes. So, sorry, I've got the taskbar is in the way. Basically, the peer is ticking the box. Which one have you done? So hopefully you'll have provided evidence of the objective activity, indicating the relevant box below if there are any gaps. As I say, it's a collaboration. It's not a paper that's being marked. If the osteopath, if the peer, you know, and the osteopath feels as though they've not really perhaps entered wholeheartedly into this particular exercise, or they feel there's some sort of gap, well, it's actually quite constructive, the peer, to write that down. And have you prescribed a thing of the method? Well, if you did oh, sorry, I've just got to admit somebody. If you've you know, if you were in our discussion at friend's house, then that is, you're providing evidence of that. So assuming that we're strengths and weaknesses, so we want the strengths and weaknesses from a case-based discussion or peer observation. So if it was a peer observation, that would be, you know, well, Tony undressed, you know, the patient gets undressed and he talks to them in their underwear. So, and I've reflected on that. So that would be that. So strength and weakness. So on the case-based discussion, as I say, I can't really provide you with the answer because for you to write down your own answer. But that's the bit that you fill in. So if you're having difficulty with that, then let me know later. So we're on to standard 3. And there we go. Well, I know we're not on time. We're sorry, we're still on. Have you reflected? Well, obviously you're going to want to put yes. It's probably a good idea, and it's probably a strength if you put down your weakness. I mean, I know you probably just want to just put yes, and then comment, you know, he's done it, and then, you know, that's activity and that's dealt with. But if you really feel as though there's something that you're not quite happy about or sure about, then why not write it down? Now, this is now periodic guidance. This is the sort of thing where, you know, I know people probably get work. So that's the asked about have an action. Well, you know, I could make a suggestion as regards what that is, but I don't want to tell you because I've got a horrible feeling that you'll just write down what I've said and then put that in the box. So if you can use your imagination, gaps have been identified. yeah, so if I'd done the peer discussion review and I thought, well, actually, or, you know, we did on the questioning and I thought, well, actually, I'm not sure that my questioning of the patients is brilliant because, you know, if you say that I ask them closed questions. So I might decide to do some further study in relation to that, or in relation to an unrelated peer discussion, case. As I said, you know, it might be, if you think back to your practice, if I can give you that tip, if you think back to your practice and how you think about you've communicated with patients, you can't say that you've always communicated perfectly and you've been completely in tune with what the patient was thinking. There have been times in the past where you've got the wrong end of the stick or you've made an assumption. So that's the sort of thing that you might like to put in that box. Right, now we're going on. So if anyone's unhappy about that, just make a little note and we'll deal with it at the end, because it's going to be an open forum. And I know there are some people here who've actually completed their peer discussion review, and I think they very kindly come along to offer me some sort of support, for which I'm most grateful. So it won't be just me, but if there's a question that none of us can answer, then I can refer it to the QSC and it'll be anonymous, so you won't get into trouble, but you won't get into trouble anyway. So osteopathic standard 3. So you've got to show that you've done, so really it's just asking you if you've done something in communication and consent. And honestly, this is the last most difficult question that you're going to answer, and it's not a difficult question, is it? It's just asking you whether you've done it, and you have done it if you're a loyal member of LOS. Now, let me see the peer guidance. So, well, yeah, they said that they recommend you do 3 hours. If you haven't done 3 hours, you know, it's not the end of the world, but obviously the complaints that the GOS get about osteopaths are almost invariably, not invariably, but almost invariably about poor communication, people getting the wrong end of the stick. You know, oh, he left me on the bed, then he went and, you know, took a phone, then he was letting people in, somebody walked in the room, you know, and I thought he was going to do that. So it's about communication. So that's why they're stressing communication on this one. So once again, the box is much bigger. Now, in case you think you haven't done anything on communication, I'll just refer you onto these two that we've already touched upon. So Jo Wilder, you know, she was talking about mental health of your patients. She went into it in great detail. And well, I don't know if, you know, if Julie Stone's lecture didn't cover it, then I don't know what does. So the next bit is the peer, what the peer says. So basically, it's you know, have you done it? So that's ticking a box. So it's asking you how. Well, you've done 2 seminars. Obviously, if you haven't done any seminars, you haven't done anything on it, then I would go through all your CPD and see whether anything ticks that particular box. And if it hasn't, then you've got to do it. But I think you've done it. If you've been with us, and you'd have done these 2, you've done it, and you've probably done more. So, you know, really, you've completed your CPD, you've completed your peer discussion review. I haven't come to the end of the form. Don't get too excited. There are a couple. The next question you've done, and that is, have you maintained a record? So on this one, I don't think anyone's under the impression that you're required to thumb through or go through with a calculator and tot up how many hours you've done, how many hours the osteopath has done on their own and with other people. But you are required to look at that. Now, I said I wasn't going to make it complicated, but this kind of is a bit complicated. If you've kept it online, you can actually download it as a tab delimited file, which you could send as an Excel file to your peer. But if you've done it on paper, or even if you've done it on the computer, you'll have the computer there, and then the osteopath will just be able to, get an idea that you're keeping a proper record. And as I said at the outset, make sure you answer the question. Now, there's a blue box there, which puzzled me, and I thought about it for long and hard. And I thought, well, is that box purely decorative? And actually, that box is purely decorative. You don't have to put anything there. The peer has to put something here. So have you demonstrated that you've done the CPD for this CPD cycle? That's ticking a box. And then the next box is if no, well, you've done it, haven't you? If you haven't done it, well, you've got to do it. The peer is not going to put yes if the answer's no. Your file's in a complete mess. It doesn't look as though you've done the thing, done what you've asked. So the peer can't sign that. And now I was under a misapprehension as far as this is concerned, because I thought that the peer could actually put yes and then put in the comment section underneath that we can see. Tony hasn't actually done it, but he's promised that he will. But that doesn't, you don't put yes as that. You have to put no. And then in the box, you say, Tony has not done anything on communication and consent, but he has stated that he will do so before the end of his CPD cycle. That's a 3-year cycle. So, as I say, it's collaborative and not conspiratorial. So the next section is just you. It's up to you who completes the next section. This is just reflection on the process. So you're together with your peer, and you've had a cup of tea, you've discussed osteopathic things, you've discussed your everything that we've been talking about, and the peer might say, well, actually, I think Tony, that you're for example, the strength that you've shown a wide range of CPD. I'm impressed you did that, such and such a course, and you're obviously, you like that. So I think that's one of your strengths. And you yourself have identified that you're rusty in neurological examination or osteopathic techniques, or you want the latest on cervical manipulation, so that would be an area for development. And comment is anything that you want to add of a general nature, doesn't have to be critical, just on a reflective nature. Okay. So we've nearly come to the end, and I hope that you agree that it's not as daunting as you were perhaps thinking that it was, because I think it's quite straightforward, really. You have to think a bit on number 2, don't you? Because you have to think about what they're asking for and how to, well, it's not ticking a box, it's using your imagination and being constructive to improve your thinking about your practice and the realization of that thought process. So the next thing you have to fill in is your action plan for the next 3-year cycle. So as I was saying, areas for development. So, I'm thinking, well, you know what, I think my neurology is not that great. So I'm going to, so don't write this down, because you've got to put your own thing down, obviously. You think, my neurology isn't that great. I think that my temporary neurology is not that great. So in the next 3-year cycle, I'm going to concentrate on that. Or I think my communication, the way I communicate with patients, I'm not sure that it's a lot of them seem to get the wrong end of the stick, and a lot of people only come once, and so I must be doing something wrong, so I want to remediate that. So that's how I would that's what's example of things that you would put. So they've given some examples. Now, I was delighted to discover that, but it is actually there, so I don't know why I should have been delighted. So you're seeking out a mentor. Well, let's say it's called a mentor, or it's somebody just to tell you how to do something, a business, clinical, or communication. So the thing that I was delighted at, not that I think I need it, but it could be on communication. It could be actually some sort of IT skill that you want to improve on if you think it's going to improve the nature of your practice. So that's one of the things you could put. And then we're nearly at the end. Somebody's put their hand up. Okay, we'll deal with it in a moment, Pragna, if you don't mind, because I've just nearly finished. So the next page is anything else you want to say. And then, so really, you've completed your peer discussion review, because the next pages really are ticking. So it's going over what we've already been through. Has he done it? So they really, you know, sort of getting you to sign that you've done it. And as I said before, if I haven't done 90 hours, or if I haven't met CPD standard 1, you don't sign that. You say, Tony, you haven't met that, so I can't sign it. You're the peer. You say, Tony, you haven't met that requirement. I'll have to leave that box blank. And then when you've done it, tell me about it. You know, let me know that you've done it, and then I'll be happy to sign that. And similarly with the other questions are sought to ensure that CPD benefits their patients. Well, that's CPD standard 3, that communication and consent we already dealt with. And then lastly, we have the declaration by the peer that he'd done it, but you only do that when you are completely happy. And similarly, the osteopath makes their solemn declaration that they've done it. And that's the end. So before I open it up to everybody, if you could bear with me just one moment, and I'll find out what all the things that are wrong with what I've said. But okay, so sorry. Sorry, I've just wanted to do another poll, and I thought that the oh, maybe I have to stop sharing. Yeah, I think I have to stop sharing to do another poll. So I'll stop sharing, and you'll have me again. So share. Okay, and then I'll see if I can just get you to do the poll, the next poll. Oh, I know, I should have, perhaps I should have exited. Just a moment. No, I wanted to give you another poll because I wanted to see whether people had changed their minds at all about polls, but I don't seem able to. Oh yes, okay, I've done it, right, done it. Sorry to keep you waiting. Okay, there's another poll. So if you wouldn't mind answering the question, and guess what? I didn't write down how many people. I meant to write down how many people had replied. So, but it's looking good. It's looking good. Actually, the reason I didn't put down the number is because it didn't tell me the number. Okay, now I'm about to share, so some people seem to be changing their minds about whether they feel positive or negative. I don't think it's made any difference, but the only thing is that we've had more people join since I did the poll at the beginning. For the people that joined late, we did a poll at the beginning and we did a poll at the end. And actually the poll looked rather like that. So I may have failed in my purpose, which was to get you to do, my only purpose was to get you to do the peer discussion review and not to, so you weren't daunted by it. But I seem to have failed in my purpose. I'm very sorry. But hopefully you'll go on to do your peer discussion review. I was told that actually some people were thinking of leaving the profession because they were so cheesed off by the idea of doing peer discussion review. If you do feel that way, well, I hope this has changed your mind. So I believe that you are now seeing me. And what I'd like to do, well, there's some people who put some things in the chat box. So maybe we could slow down. Did somebody say slow down? Yeah, that's right. But need to get hands on with the process before I can really say whether I'm positive or not. Oh, fair enough. Let me just see what other people have said. Okay, somebody's. So you've probably been looking at this. I'm just. So you're talking about a piece of software which I'm completely unfamiliar with. Yeah. Oh yeah, no, that's absolutely right. Yes, Salome, you have to keep it just in case you're audited. Yeah, I hope I made that plain at the outset. Yeah, you don't submit it. Yeah, I dealt with that in the beginning because some people weren't sure. You know, you got this period. So what happens now? Who do I send it to? So I'd like to open it up to everybody now. You're probably fed up with my voice. So if anyone has done the peer review and they have got any comments, obviously we don't want you to go on a blow-by-blow basis of what you put on each question, but just a general, any tips you could give anybody, plus if anyone's got any observations they want to make, or if anyone has got any questions. So you're all on mute, so I'll leave it up to you to unmute yourself and contribute. It's an open forum, and it's we've been going for an hour. So, but at least I did it. That's what I wanted. That we completed the thing, because I thought, oh, if we have we go on to part 2, then you're going to be really daunted. So I hope I've reassured you in some way. Okay, yes, go ahead, Peter.
Yes, I put in the chat box there that I actually did this on Friday with an old friend from probably retired or super, and we basically we made it far more complex than you have spoken about there. It took us a good 2 hours, and then we reviewed and sent copies back to each other as we had to adjust little parts. I'm really surprised that we didn't have to submit it. I've been searching on the GLC's website for how to submit it and emailed them, and they've not got back to me. So I feel like I've wasted a lot of time. But also, I did find a lot of the questions seem to overlap. They seem to be asking the same question time and time again in slightly different ways.
So why do you feel it was, because did you submit your questions in advance? Did you fill in your PDR in advance, Peter?
So did I fill in what?
Did you fill in your from the osteopathic point of view, did you fill that in advance? Or did you fill it in while you were both together?
No, we did what was recommended. So in the guidance notes that has a template at the end, we both read through that, and I filled in the first and last sections that I need to fill in, and we made notes about what we wanted to discuss. We met together, spent a good 2 hours discussing it, and then I basically typed it up into the template, and then I was looking for somewhere to send it to, and turns out I don't have to send it anymore.
No, but of course you could be audited and they may ask for it. So Peter, do you think so? Do you think you wasted some time? Because I presented a simplified version because I know that people were antithetical to some people are antithetical to the whole thing. So I just wanted to, well, at least we could do the simple things. Obviously, if you want to make it more complicated. So do you think you made it more complicated than it needed to be? Or
I think we did. You know, my peer reviewer is he's been in osteopathic education, and he's now a tutor for school children, and it was really almost like doing an exam, doing a formal examination. You know, we approached it really in a lot of detail, and we were rather we found it difficult because a lot of the questions seemed to overlap. A lot of them seemed a bit pointless, really. You know, when you tick the box yes, do you need to put in details below that or not? It really wasn't clear in that respect.
I think that's fair enough. I must admit, I was a bit surprised when you had to make a sort of solemn declaration at the end, you know, repeat everything all over again.
Yeah.
I didn't find that the questions themselves were repetitive because they fitted into 4 categories. As I said, number 4 was actually just, have you done it? Yes. So that was ticking a box. And number 1 was, you know, pretty straightforward. Thinking about it, I thought the only one where people might have a little bit of problem where, because I couldn't really help you too much because I didn't want to give you, you know, to say what to put down. But apart from that, did you still think it was repetitive, apart from the fact they were asking you to repeat that you'd done something, Peter?
I did. We started off with question 1, really doing a summary of everything that I'd done. Perhaps that wasn't necessary. You know, that was the way that my peer reviewer sort of approached it.
Oh, I see. Right. Okay. Yeah. That was making it far. Yeah. I mean, I don't know if I said it at the time, but when you're doing question 1, which is, you know, A, B, C, and D, you only need put 1 example of each. I mean, you probably want to pick a good example of each,
yeah.
But you only need put 1 example of each.
Yeah. When we had a good page of A4 on that.
Yeah. Okay. Yeah. It's not necessary. Well, I hope that I haven't oversimplified things. I mean, I wanted to simplify things so that people, because my objective was that you do your peer discussion review, because you have to do it to continue to be an osteopath.
Yeah.
So, has anyone else? Thank you very much, Peter. That was very useful, and I'm sure people will take something from that. Has anyone got anything else they want to ask or say?
Can I ask something?
Please go ahead.
Hi, Tony. The whole thing, as it comes over to me, or did anyway, was a little bit, in some aspects, like a Catholic confession. Yeah, I remember when I was a kid, I had to make something up because one wouldn't believe you that you didn't do anything nasty. And with the peer review, I mean, it just occurred to me while you were talking that actually it's probably also possible to put something positive where I say, okay, I think I've done that actually quite well, and does my peer agree? Yeah. So can we look at it that way as well, so it doesn't becomes less of a tick box exercise, but also more complementary and helpful in that sense.
Have you changed your view of it, Anna, or do you still? Because I was brought up as a Catholic as well, and I must admit, you know, it was at one stage I thought it was on the second one where I thought, well, you know, areas for improvement. I remember as you probably did as a 6-year-old confessing to sins that I hadn't even committed. You know, just in order to say something, you know, and I'm sure that actually the priest knew that. But anyway, let's not get caught up in ecclesiastical matters. So the point is to improve your practice. They would say, well, your practice is not perfect. You know, obviously your practice is not perfect. And also, you know, a lot of us do work on our own, and a lot of us do. Well, I don't think we do now, because the people that are present are actually participants in the process, you know, so But let's face it, the reason we're here is because of the original CPD. I think we could all be, you know, isolated. So it's getting us to think. So has your impression improved, Anna, or do you still think it's a confession?
No, not completely. I mean, if I think of it, that I mean, like you say, I mean, I spoke with a colleague the other day, and we both agreed that there's always something that you can learn. Yeah, we wanted to do the case history together because I had done several case histories, but this was because I trained as an acupuncturist as well. And so I'm joining a regular acupuncture local group meeting, and we do regular discuss cases there. Problem is, I didn't take it down the way that Gost wants us to take things down. Because I mean, obviously I hadn't looked properly, and so I can't use those cases because I don't have a peer from the acupuncture group to say, okay, you've ticked these boxes. Yeah. So
I find it hard to believe that you actually were discussing, you know, you were doing, I mean, I know it's a different sort of different procedure, but I would have thought that, I mean, I don't know, and we don't.
I mean, they could sign it, but I didn't ask anybody. So for the peer review, just for filling in the forms, I would find it easier to do that actually with an osteopath. I mean, that doesn't mean I can't utilize the acupuncture or that sort of thing. That's nonsense. I think there is a lot that can be interlinked there. And I'm not talking dry needling here, I'm talking TCM acupuncture. So it does make it a bit more complicated. So if I come over with saying, okay, I've done this with acupuncture, then I have to explain it, because normally, unless you have studied acupuncture, TCM, then you won't know what I'm talking about.
All right. Okay, Anna, that's great. I hope people found that helpful. But thanks very much, Anna. Lorna, have you got a
there's
question?
one more thing.
Oh, I'm sorry. Yeah.
The case histories. Can we just discuss one case history, or do we have to discuss a case history of ourselves each time? So if you discuss a case history, do I have to discuss one of mine and then my colleague has to discuss one of theirs, or can it be one case history and we both discuss it? And
you can have one. I mean,
yeah.
look, you know, with the examples I gave you of webinars that we've done at LOS,
yeah.
You know, the second ones I gave you were actually in the previous one. So don't worry about that. As long as it's you know, you reflected on it yourself. No, that's absolutely fine. You could do, because let's face it, if people use the example that David and I did, then there's going to be, you know, possibly 40 people using the same example. But as long as they've all brought something from it, and it's you know, made some impinge on their practice in some way, that's absolutely fine. And in fact, there's one thing I didn't mention, and that is, if you really get stuck, I suppose if you really get stuck, you could say next year. But if you did more than one peer, if you were the peer, and you got to thinking as a result of your peer discussion review about something, that perhaps there was an area which, you know, you could improve upon. And actually this did happen to me when I did my PDR. You could use that as on the form for an area for remediation. So you could use that, the peer discussion review itself. Obviously not the one you're doing now, but you know, saying, but the one that when you're the peer, if you pick up something from being the peer, you could include that as well. So there's another, you know, thing you can write. So thanks very much, Anna. Lorna, do you have a question?
Yes, I do, Tony. Hi. I tried to download the form a couple of months ago and found it practically impossible. And I was pleased to see that Stephen Bruce from the Academy of Medical Science said the same thing. Could you give us a quick run through how to get the form? What,
you mean the peer discussion review?
Yeah.
Oh, well, yeah, just go to the LOS website. I've put it there. It's a Word document. It's a Word document.
I can download it from the LOS website now.
Yeah, it's on our homepage. And, you know, for question 1, A, B, C, and D, I think that's a great form. I mean, you know, people are probably doing it electronically, but you could actually use that form for doing the A, B, C, and D. It's a sort of self-contained form. I've also put that on the homepage. So if you want to download that, obviously it's up to you.
It's very difficult to get it off the GOC.
Yeah, well, you have to wade through a load of stuff, but no, it's on the homepage. You know, I mean, it should be straightforward.
Great.
Yeah. Okay.
Thanks so much.
Okay. Anyone else would like to got any questions or I've done the PDF? Oh, sorry. Yeah.
Hi, I'm Carla. Hi, everybody. I am very out of touch with this process, I'm afraid, being honest. So what I wanted to ask you, Tony, was when you were talking earlier on about people attending talks on, for example, communication and boundaries, for example, if you haven't attended a talk, but you are pretty au fait with these concepts because of your own multidisciplinary kind of involvement, could you just answer it through your own experience, or are you wanting some kind of professional backup or academic backup? I wasn't quite sure. I didn't quite understand that.
You have to have done something. So it's not enough for it to be in your history. You know, because actually, because it's a 3-year cycle. So, you know, 4 years ago, we may have done a communication consent thing, but that doesn't count either. It's got to be within the current 3-year cycle. So just having that as a life experience is not. You want to do something on communicate. You want to do an actual activity of at least an hour on that.
So can you give me an example? What kind of activity you're talking about? Are you talking about perhaps having friends who therapists where you discuss a boundary or a case history, or you might be involved in another discipline or another training where that comes up? Can you give me an example of what would be acceptable?
I think if it was struck, I think, are we talking about number 3, which was
Possibly, yeah. I mean, yeah. Just as an example, I mean, even though it might be a short answer, but, you know, it's something I've just happened to, you know, discuss a lot and, you know, with colleagues and whatever, but I don't have a formal lecture that I've been to, but it's come up in lots of courses and things that I've done. But I'm just interested to know how, or you know, what you would want to prove that you've actually probably know quite a lot on the subject. There's a lot I don't know about, and maybe I would have to attend something, but I'm not just quite sure how I would actually pick that up now, or are there any suggestions that anyone can give me?
Well, I know that you've just joined Los, and so I sent you the link today. So you probably haven't attended any of our lectures. So the only thing I can really do is what I said at the outset, and that is to answer the question that they ask you. And the question they asked you is, the standard is met. So we're looking at CPD standard 3, communication and consent. They have undertaken CPD activity relating to communication and consent with patients. Communication and consent with patients, not that you've done it with patients, but that it relates to communication and consent. They have reviewed the guidance in the osteopathic practice standards, and that this has informed their learning and applied in practice. This standard is met by an osteopath who has undertaken. So they recommend that you do 3 hours, but you can do less. But you must be able to show that this activity has informed their learning and practice. So you've got to do something. You can't just have a history of having done it.
Okay.
So Tony, it's Martin Pendry here. Can I help you with an answer?
Please do, Martin.
So we've all signed up to say that we are following the osteopathic practice standards, which again we can download from the GEOS website. And I will go to professionalism, which is D and the one that everyone seems to avoid. My experience of professionalism, it keeps on changing. 2 years ago, I used to shake hands with all my patients. If I do a Google search on the word professionalism, I get lots of men shaking hands in suits. I now do an elbow bump with my patients when they come and go. So my idea of professionalism has changed. So within that title of professionalism, you then get a number of standards. And GIOSC's function is there to protect the public. So if I go to something like D4, you must have a policy in place to manage patient complaints. So you might review your policy on complaints. A lot of you are single-handed practitioners, and so you will have a policy because you've signed up to say that you have it, and therefore you might wish to review it to see if it actually works. So the first time you put it in place, you then get a few, or hopefully you don't get any complaints, but we all get feedback and comments. Hopefully you have if you're a single-handed practitioner, hopefully you've spoken to your colleague down the road who is your next level in terms of escalating that complaint, because you don't really want GIOS to be the next level. So there are things you can put in place. So having read all those standards at the beginning of the year, you might find that you have some weaknesses or things that you need to do. It's then demonstrating that you've done that. I think it's 25 years this year since I qualified from the BSO, which to me now sounds like a long, long time ago. And complaints wasn't really ever taught to me. So I've had to learn about that since then. I did spend 21 years in the NHS, so we have a whole team who manage that on our behalf, but there is a policy and procedure in place. But if you're a single-handed practitioner, you need to comply with that standard. So that might be an example of how you reflect on your practice and how you then might improve things. Because don't forget, at the end of the day, GIOSC's role is there to protect the public. And I think if you read through what's in each of those 4 themes, we probably all get a list of things to do. And the one we probably all know quite well is our sort of origin insertions, our clinical examinations, all that bit we do quite well. It's the bits behind there that we are probably challenged by. Does that help?
Yeah. Hi.
Hello. Thank you very much. I just thank Martin. Thank you very much for that, Martin. Yeah,
Hi,
Eva.
Hello. Hi. I was just wondering, for instance, could you use an article on communication from the institute, the professional magazine, as if you read it and reflect on that? So the paper format that you read the article, you worked on that. As an example.
Are we talking about communication and consent?
Yes, in connection with the colleague, the lady colleague who spoke before about how to
right, yeah, okay. So communicate with us.
back you up or present some evidence of having worked on communication. So I was wondering if reading an article, showing proof of having read an article on communication could be a way to go about that.
Yes, it could be. Preferably not a 15-minute article
Sure.
in the Daily Mail, but if it's a serious article and you can show evidence that you've done it, it's not like number 2 where you have to show that you participated in it was a discussion, there was feedback. It has to be that you have, so in other words, the answer to that question is yes, providing it's not too lightweight. And I
was thinking of the Osteopath magazine. From time to time they come up with articles about communication. So just from not really.
I think it's a bit thin, a magazine article, and also, the Osteopath hasn't been printed for something like a year, so I think it's a bit thin. I'd do something else.
Right. Okay, thank you.
Okay. Has anyone else got any comments or questions they'd like to ask? Nita.
Oh, hi there, Tony. Just the lady who just spoke earlier just now on the magazine, surely you could read an article and then when you reflect on it and you look back onto your case histories or your clinical experience with particular patients, you can use those as examples where you've used communication and consent.
Right.
Could you use that as an example? Could you do
it is, but
word?
the trouble is, I think you're kind of mixing up 2 of the standards there, because you're talking about reflecting on something, and so did you just say reflect on your practice?
Yeah, because you're basically let's say you read an article in the IO magazine, right? And then that's actually made you reflect on it and think, oh, well, was I doing that in my practice, or did I miss that with that particular case? And then when you've reflected on that, you've then gone back and then changed your approach in your clinical practice as a result of. So that's kind of you've addressed that communication area that you're probably weak on, and you can apply it that way.
I think that addresses the reflecting on your practice at the end of the form when you've answered all the questions. But as far as doing something on communication and consent, I'm not sure about reading I mean, if you read an article and it had references and you looked up the references, I think it would be more substantial. It sort of sounds a bit thin, doesn't it, reading a magazine article? I'm not sure there's enough there, really.
Okay.
Only an opinion. I mean, you could, try and see, but I would have thought, I don't think that's quite enough. Anyone else got anything they'd like to? But thank you very much for that observation.
Christine Lister's been trying to come in for some time.
Thank you. Hi, Tony. My question is about case discussion with a colleague. If you have a patient you've seen that's very interesting and you want to use that, and you discuss it with a colleague, but only one of you's seen the patient, can you both use that case discussion, or can it only be used by the osteopath that saw the patient?
If you both take something from it, you can both use it.
Great, thanks.
Sorry, Christine, I didn't see you. Pragna, didn't you have a question to ask, or maybe it's been answered, or maybe you've gone? I don't know. Perhaps that's it. Does anyone? What I was going to suggest was that now, if you're looking for somebody to work with, if you go to the OIS site, you don't have to be an OIS member. You can just look up. An alternative would be, I thought, well, possibly that if you put your location in the chat box and there's somebody near you, because if you're in, Barnet, then you might like to get together with somebody in somewhere near Barnet, Potter's Bar, say, as opposed to somewhere in Clapham. So I just thought that might be an idea if you wanted to pair up with somebody if you don't have a peer. So, but has anyone got any other questions? Ron, did you want to add anything? No. Well, people have either they're on mute, or they've fallen asleep, or they've gone home. As long as you do your peer discussion review, because you've got to do it. So, okay, so that's it. So thank you very much for contributing. This will count towards your CPD. I hope you found it useful, and I hope any fears, apprehensions have been dispelled. I don't think it's quite as difficult as it I think if you don't, if it's a thing in the background and you don't actually go through it, it becomes bigger than it actually is. I don't think it's that big a deal, really. I hope you agree with me. Anyway, listen, thanks very much for participating. I hope you found it useful. We'll look forward to seeing you again. I hope you have an interesting 2022, and I hope that we're going to see each other soon. So bye for now.